Welcome to the DNA Talks podcast, where we take on the mission of unlocking the code of your genetics. This season is all about you, upgrading your health, not just on the surface, but down to the root cause. Join us as your clinicians at the DNA company investigate your DNA and beyond. The intention of this podcast is to enhance your lifestyle by changing what is in your control. This does not substitute the medical advice given by your personal doctor, therapist, and other healthcare professionals.
Welcome, everyone, to tonight's discussion, where we're going to be exploring breast cancer, and more specifically, how do we think about both prevention and awareness of it? Based on family history, based on personal history, based on willingness, this is going to look very different for many people. And so we want to have the conversation around risk factors. We want to have the conversation around different tools at your disposal that can go about from screening perspectives, from early detection perspectives, and then separately, what do you do to the ends of prevention, right? How do you actually prevent anything turning up on that early detection, on that screening? This evening, I am bolstered, supported, and surrounded and in conversation with some wonderful women. I'm going to allow them each in a second to introduce themselves and why they're so passionate and what they can share about this space in just a second. As we're doing that, though, please do fill out the survey. We really want to know who's here this evening. We're asking about age groups, we're asking about motivations. That sort of stuff will really help educate us as to who we're talking to, so we can be more pointed to you as opposed to the general idea of who you might be. Ladies, welcome. It's so delightful to have you here again. You're my frequent offenders, and it makes me very happy that we're together as a foursome again.
Well, I can see two of us are still in the heat and two of us are starting to get chilly.
I'd call 78 degrees pretty darn nice.
Yeah, well, we started at 32 this morning and then it went up to 90 and I had a different top on. And I'm like, I am not going to make it. And I see Betty's and I'm like, I should have gone more summer.
Yeah, we're in Texas. We still have, we had a few days where it was faking us out. It's bad.
I got a sheer on, but I did long sleeves. So
Yes.
Hello. So why don't we each take a turn and just quickly for our audience introduce ourselves, because I want to make sure people understand the expertise and the intelligence that we're coming at them in regards to breast cancer. So maybe this is an arbitrary working around who I see on my screen. Dr. Steph, do you want to kick us off?
I can. My name is Dr. Stephanie Nielsen. I am a pharmacist by training. I'm a board certified clinical nutritionist, and I'm a certified functional genomic practitioner. So I like natural medicine. I understand all the Western-based and all the drugs. There are some drugs that are appropriate. There are many that just symptom stomp. I think one of the greatest things we can do for our life is understand our DNA and the lifestyle that we live so that we can either turn those genes on or help turn them off. And tonight we're going to talk about some of those lifestyle things that you can do to optimize your DNA and your health.
Mm-hmm. Dr. Betty, what about yourself?
Sure. So my name is Dr. Betty Murray, a clinical nutritionist and women's health researcher and Institute for Functional Medicine certified practitioner. And I've owned a clinic for 20 years. My area of study, particularly for my PhD, was hormone metabolism, both the genetics and how we metabolize hormones. So this is an area that I'm extremely passionate about because I think it's very confusing and it's hard to navigate. So I'm hoping that I can share some light tonight.
Well, to a confusing meeting, once upon a time, they told us it was hysteria. Our uterus was running around the body, and that was that.
We haven't gotten that far from there.
Yeah. Dr. Lara, why don't you introduce yourself?
Hi, everyone. My name is Dr. Laura Varden. I am a PhD with specialties in cellular biology, molecular genetics. I'm also an in-house clinician here for the DNA company and dean of the DNA University. I am actually a board-certified holistic health practitioner and functional genomics certified, as well as certified in functional nutrition. So I love everything from the subcellular to the macro and everything in between. So I really like digging into the education related genes and helping people to become the best that they can be. So here in an educational supportive measure.
So ladies, why don't we kick things off and set the stage? Let's talk about different risk factors towards breast cancer. Who's most at risk? Who needs to be, other than females in general, who needs to be concerned about this? Yeah. Who wants to start with maybe some statistics?
I'll throw some out.
Let's hear those numbers. I love
I
it.
love math. So obviously women, postmenopausal women, so women generally over 50, 51, have a greater risk of breast cancer. So the current stats are 4 in 1,000 women will have breast cancer postmenopausally. What I think is even more important is what are the greatest lifestyle risk factors we could have for that? And it's two things that, well, one thing people don't like to give up, and the other thing people most frustrated with. So the first of all is alcohol consumption and weight, how much weight we have. So alcohol consumption, 1 drink a week or 1 drink a day and or more increases your risk anywhere from 17 to 24%, depending on the study that you read. And then obesity or being overweight increases it anywhere from 12 to 24%. And so, we just carry a greater risk as women in our 50s, as we say, seasoned.
Like fine wine that we're not supposed to drink.
That's right. We're supposed to sniff it and enjoy its bouquet.
Well, I think thankfully tides are turning a little bit and we're shifting into a renaissance where there's awareness of the beauty and the value and the splendor that comes with that sort of age.
Yes.
Yeah. So you've just kind of articulated to me, at least, independent of family, independent of genes, independent of all the things, weight, alcohol, to a degree, controllable risk factors that are quite significant into contributing to that risk. So what other lifestyle, or sorry, I guess, yeah, let's start with lifestyle. What other things can predispose towards risk of breast cancer?
Well, from a DNA perspective, not being able to detoxify. So many of us live in a toxic environment and a self-created toxic environment that we don't even understand. So let's think about dryer sheets in our dryer. Increase the air where it comes out of that dryer by over 4 times the air that would come out without a dryer sheet. And those are toxic volatile oils. If you look about not changing your air filters in your house, if you look at going from this box that we call a house to the box that we call a car, and then you have your little fresheners in there, to the box that we call work, and then we have all of these little boxes that are running around each other, putting off fumes. And then we go to boxes called stores. All this indoor air pollution, a lot of people don't realize how toxic an environment is. Every time you walk down an aisle where all the laundry soaps are, and woo, it's so fragrant. Or you walk down the aisle with all the candles and woo, it's so fragrant. All of those are giving off toxins that not all of us can detoxify. And when you lead, a lot of those toxins, those environmental toxins, are also hormone modulators or estrogen or endocrine disruptors. And so we've got to learn, how do I have a non-toxic or as little of a toxic environment, whether it's hair care products, skin care products, and then of course we can get into foods. So there's a lot in our environment that we don't even think about, where we live, how we live, and the products that we use that people don't realize are killing us.
I would add to that we all are exposed to toxins, and there is a certain amount of issues that can happen with that overload of toxins. But if we look at someone's DNA, we can see where their weak spots are, with these exposures, and, do more of a pinpoint on how we can support, obviously, mitigation from, exposures to these toxins is really number one. But then how do we support the body, for each person that we are working with? How do we support your detox pathways specifically for you, to help support? Because I'll tell you what, you live on this planet, in this world, at this time. You are never going to get away from all of the chemicals we are exposed to. And just to kind of give an idea, of products, Dr. Stephanie has already mentioned a couple, but specifically you're thinking, oh, wait, endocrine disruptors, estrogen mimetics. These are basically compounds that act like estrogen, not exactly, obviously, but that can disrupt that normal hormone pathway. But things like BPA, bisphenol A. These are found in plastics, food can linings. There are phthalates. These are plasticizers. The things in like PVC, cosmetics, personal care products. There's parabens, there's PCBs, dioxins. I mean, the pesticides that we are exposed to, like atrazine, DDT, glyphosate. It's like it is in and all around you, but it's educating yourself on where can these things be found so I can lower my exposure.
Yeah.
So, very important.
It's tricky to hear that the products that were fed to us as females, here's the makeup, here's the hair care, here's the things that make you smell nice, are now the things we're teasing out as the things that increase risk towards. So I wonder if we shift the conversation a little bit, because we just talked about some controllable things. Stress, it's an incredible risk factor towards cancer, but I wonder if we start talking about some of the other ones that we don't necessarily have control over. Why don't we talk about the BRCA genes? Why don't we talk about the family history element of it? Why don't we talk about the things that we're kind of born into this world with? Yeah. Who wants to first talk about BRCA? Because I think this is the most synonymous thing that, a lot of breast cancer awareness is put into this. If you have a family history, chances are there's people in our audience who know their BRCA status. Why don't we talk about what is BRCA? Why do some people know their status? Why is it important? And why may it not also be important?
So I can jump in on this one. So it's really important to understand the BRCA genes. These are tumor suppressor genes. They play a very crucial role in maintaining the integrity of DNA. They help to repair DNA damage, and they ensure that that genetic material remains stable, that it's copied correctly when our cells split and divide. And BRCA, BRCA1 and 2, they help prevent cells from growing uncontrollably, forming tumors. So, it's really important to understand what their main job is. They do not cause cancer. What ends up happening is that if they are dysregulated, if the genes are mutated, then their ability to repair the DNA damage is impaired. They're not able to do their jobs very well. And that can lead to genetic errors that can accumulate over time. And this is what can result in cancer. So women with inherited mutations of BRCA1 or 2 have a much higher risk of developing breast and ovarian cancers compared to general population. This goes for men too. They are not outside getting breast cancer.
Yes, ma'am.
Also very important.
And then there's also Lynch syndrome, which is a genetic disorder that you have a greater risk for several cancers: colon cancer, pancreatic cancer, breast cancer, and it tends to run in families, but it's not very common. I think one of the important things about the BRCA gene is to recognize that of all the breast cancers, BRCA only makes up 8% of breast cancer diagnoses, that the rest of them are coming from something that are not definitively BRCA. I think that's really important. And I think the other thing we also have to think about, it's not something we can always, let's face it, it looked like, what was it, 80% or our age group? Here's something that we can do nothing about, ladies. The simple fact is, if you are child-free like I am and never had a child, never carried a fetus to term, your risk for breast cancer goes up. The more babies you have, the earlier you have them, the more of them you have, the more breastfeeding you do, the more protected you are. I think that's important to note too.
And I love that you said that only 8% of the cancers are related to BRCA. However, there are statistics that show that BRCA1 is present in up to 45 to 55% of the established cancers. So I think a lot of people grab that 45 to 50%, and BRCA2, actually it's for BRCA1, it's 50 to 65, and BRCA2, it's 45 to 50. So they hear it and they panic. They say BRCA problem. But as Dr. Lara just said, this is actually a healthy gene. This is a suppressor gene. It's only when the gene has gone bad. Genes are not really good or bad. It's, are they turned on or turned off? Are they mutated or non-mutated? And so you've got to not just say, do I have a gene, but what is that gene doing? And a lot of that's controllable. If you think of like a hot water heater, how it can be turned up or turned down, that's what we want to look at. There happen to be 10 different genes that can be related to breast cancer, but the others are 5 to 10%, show up in representative. So oftentimes they're not talked about. That's why BRCA has the big hot button. And we know that media grabs a hot button and then runs and runs and runs with it. And so they only get this much of the whole story. And then we get this much of this much. And so you hear BRCA and you panic. Yeah. Again, it goes back to lifestyle, detox, and controllable things in your environment.
Yeah. Yeah, I think it tends to always be a combination thereof. I think the World Health Organization acknowledges that 80% of cancers are lifestyle driven. There's very few, and usually those tend to be clustered in more pediatric or childhood cancers that are exclusively run by genes, right? So does having this mean your risk or increase? Sure. But there's many people with this mutation walking around without breast cancer, without ovarian cancer. There's an element of what is your body bathed in that is going to inspire this mutation to actually have detrimental impact. Okay. So let's talk about screening processes, early detection. Okay, so you're someone walking around, let's say you've done genetic workups and maybe you have this risk factor, the gene risk factor, maybe you have a history in your family, maybe, you're someone who has a history of drinking or a history of a lot of stress, or, there's a lot of things and you want to start being mindful, right? Or maybe, heaven forbid, you watched your mother or your aunt go through it and it's a memory, it's a fear in the body. Let's start talking about early detection and other screening methods, okay? Because that's what brought us here today. So what is the standard of care right now, at least when it comes to mammography?
Yeah, so the standard of care is obviously classic mammography. In some places, 3D mammography is available, which gives you a better view than older established mammography. And then if some kind of abnormal cell is found or some sort of abnormal imaging, often a follow-up mammogram and then sonogram is done. If those two come back, the next step is often biopsy to look at the tissue itself, and they leave a tracer in the breast, and then MRI if that all comes back true. Although there are newer technologies, which I'm excited we're talking about a couple tonight. There is one imaging technology I did see a couple people ask that many people probably don't know about. It doesn't have a lot of availability in the US right now, and it's called QT imaging, which is as sensitive as an MRI, but does not require squashing the breast or any radiation. And they're spread out across the United States. Hopefully we'll see a lot more of them over the next 5 years or so opening up. But all of those imaging technologies have their strengths and drawbacks. And they're all detection. That's the reality, is they're detection. They're not a prevention tool, they're a finding it tool.
And I think to your point as well, there's also this element of having to physically go to a location, having to open your body up to very invasive either positioning or whatever it might be, radiation. There's an element of you must be close to one, and then you must have an appointment to one. And further to that, you also have to be within certain screening guidelines, right? I think most screening will start in and around 50 unless there's indication family history, and then it's younger. Is that true? Do I have that approximate?
Yeah, it's getting a little bit younger. I think it's dropping down into the 40s. But then there's, I think there's an appropriate time and place for screening. But there is also the concern of frequent radiation of, highly sensitive tissue and the risk for changes to cellular, DNA and mechanics from just, frequent radiation. And so, I lean on that side that I think it can be overused. And some of the studies show that frequent imaging, yes, might catch out of that 4 in 1,000, they might catch up to 8 in 1,000, but in that somewhere between 92 and 95 people will get treated for a cancer that was small enough to have been left alone that the body would have taken care of. So we also overtreat. So we subject these women to chemotherapy, lumpectomy, and hopefully not mastectomy, but radiation, and cause, extraordinary harm. And so I think it's a dance of how much and not too much. And there's other ways to detect and be preventative.
Interesting.
And I think a lot of screening, when we're talking about women and breasts, Betty's exactly right. That happens a lot where people are over detected, but it also happens in men with prostate. The PSA, you may have a minor elevation and then they run with it. And then men are having these prostatectomies. And I have a friend who had a prostatectomy And we had done a bunch of lifestyle and nutritional changes. And he said because of his stress, he just didn't want to leave the prostate in. And when they took it out and did all his pathology, he was completely clear. He had cleared it with all of the natural things we had done, but he couldn't convince himself. So a big part of any screening, whether it's a manual breast test that you do yourself, whether it's a lifestyle change, is screening is just that. It gives you an awareness. And hopefully that awareness says, oops, let's make a change now. I saw someone early, and I'll have to go back and look, and somebody said, I always weighed 175 pounds, and then I had some negative breast health, and now I'm 130, because it was that pivotal life event that they needed to have that motivation to really make a definitive change. And there are multiple cancer researchers that say a majority of cancers are fully preventable with lifestyle, between low carb diets, between movement and exercise, between plenty of sunshine, between the types of food you're eating, between, there's just a non-toxic, between getting decent sleep, not just taking a sleeping pill and shutting your eyes, but getting real sleep where your body can heal,
Yeah. Yeah. I think what you're alluding to in particular, the idea that screening for and managing various stages of cancer is such a choose your own adventure. There's no right path per se, but there needs to be a very well-informed and well-trusting conversation between you and your healthcare provider to figure out what is that right path, right? Your friend made that decision that it is better for my mental health and my overall well-being to have my prostate removed than kind of live with this daily fear. Whereas another person might have said, yeah, I'll manage the fear. I'd rather have my prostate, right?
Well, and I have a very dear girlfriend whose granddaughter just decided to have a double mastectomy because she carried the BRCA1 and BRCA2. Now that's more prevalent in Jewish ethnicity, and their family was Jewish. They had had multiple aunts and mothers and grandmothers that had had lumps. A couple had had cancer, some had not. But again, she chose to do prevention of having her breasts removed. Unfortunately, I think, and when I discussed this with her, I said she still has to do the lifestyle changes, because even removing that breast tissue, there could still be a problem if she doesn't stop the smoking, because it's very fashionable again to be out at the bars and have us, between drinking and smoking, and again, the detoxification. So knowing that you don't have to abstain from everything all the time, but it's the majority, it's the 90-10 rule, rather than, and being aware, what are my risk factors? And then, every bite either heals or hurts. So, do you choose to say, okay, this one time, but if every day is a one time, that's called a lifestyle. That's not called an exception. And so knowing your genetics, knowing your pathways, knowing your detoxification, knowing, do you process vitamins like your antioxidants or your vitamin D? Do you need help with that? Can you utilize glutathione? Do you methylate or not methylate? We have so many pathways that we can look at and say, am I a good detoxifier? And how much can I push it?
Yeah. Okay. So as part of that comprehensive plan, right, you're kind of ticking all the boxes when it comes to diet and lifestyle, right? Dr. Steph, I wonder if you can speak to a little bit of your journey, namely how you brought us one of the early detection tools, right? Because I think there's people who are maybe in their 30s, family history, they're concerned, but they don't fall within screening guidelines. Or perhaps they're in between screening guidelines and it's gnawing at their head. What testing did you find for these people?
Well, again, always being a researcher, always digging in, I happened to meet a woman, and she introduced me to her fiance, and he's been in the medical industry and sold 4 different companies, and said he and his team had developed a new screening tool. So well, I'm going to encourage everyone to know their breasts intimately and to do at the same time every month a manual exam, all through, because you know your body best. You have a PhD in you. One of the things that they had developed is that there are some specific proteins that accumulate in the eye fluid, and taking a small piece of ophthalmic paper and putting it in and absorbing a few tears for a total of 5 minutes. Then you send that sample in and do this at the privacy of your home, the comfort of your home, and then you will get a report back that says either it's insignificant or it's significant for those proteins. And the significant says dig further. So for me, being healthy, being a health provider, being of my same ideal weight, living this country lifestyle, I have chickens in my yard and all this kind of stuff. I just knew that mine was going to sail through.
Yeah.
Well, I didn't. It was a very humbling experience to come back with a stark positive. Now I'm in my early 60s and I have great boobs. I've always had great boobs. I've had every, mammogram and they're like, your boobs are so great, whatever. But I just knew that I was going to fly through this and I didn't. And that was my reality check. So as clean as my diet is, because I'm a strict gluten-free and have been for years, and I eat paleo, so it's basically protein and greens, but I was having a little alcohol, maybe it wasn't every night, but maybe every other, just because I could sit on my back porch and have a lovely cocktail and chat with my folks and I was eating maybe more processed things. And because I'm gluten-free, I found some wonderful mixes for some very high carb, very high starchy, wonderful muffins. And I was having just a little too much of that. And so I had put a little weight on. I was a little swollen. I was a little inflamed and things they weren't ideal. Well, I didn't have to have a heart attack. I didn't have to have a stroke. I had to have a screening test that said, hey, your inflammation markers are up, particularly your girls may be at risk. I was having a little breast tenderness. And I said, I just put it off to, whatever, weather change or tight bras but it was a wake up call. So I immediately got in and had my mammogram, 3D mammogram, completely clear, just the way it always was. Then it was suggested that I do an A-bus. Now, this isn't something we've discussed yet. So we talked about the QT, which is a sound wave technology. I love the idea of QT. That's mainly going to be available in major metropolitan areas. I love the idea of the ultrasound. The A-bus is an automated breast screening ultrasound. And if you've never seen one, you have a big flat about the size of a laptop. It goes flat on your boob and then rolls back and forth. And then it goes sideways, back and forth, and then it goes sideways, back and forth. And they can screen. It basically flattens out all the tissue it can screen. So again, I got an all clear in my A-bus. No radiation. Love that. They found a couple very small cysts, but they said they were inconsequential and there was no calcium deposits or anything. So that was wonderful. I am now doing a new screening. So I went super, super low carb. In fact, I had gone down to Hack Your Health, which used to be KetoCon, and went super low carb, lost any remaining weight that I needed to lose, and just tightened up, and then cut out the alcohol, maybe once a week on a planned occasion, and I will only drink certain things, and basically just super clean, no more of the mixers and no more of the tonic-y, whatever. And all of it tightened up. I'll tell you what, brain is clearer, jeans fit even better, skin radiant. So I know that this screening tool that we're introducing, the DNA Breast 360, and I am so pleased that Tracy, our CEO, jumped on and said, man, oh man, if women could screen in the privacy of their home and get a thumbs up, you're doing right, or a thumbs down, we need to, let's lock arms and get some changes. How could we save the world? I just think it is so fabulous that we have this available. And young women or women who are not near major metropolitan areas or women who've had, breast cancer in the past and want something in the privacy of their home just to keep check. I mean, we've learned since COVID, screening at home and working at home and, taking that personal responsibility is just so available more than it's ever been.
Just clarity for the people listening. Stephanie, you were saying that you got on a much lower inflammation diet and really cut down on carbs. Well, the thing is, carbs include vegetables, fruits, complex carbohydrates. So are there specific carbs, more the starches? I mean, when you say you cut way down on carbs, does that include the complex carbohydrate or,
For me, it did. For not everybody's a fan of the blood type diet, but I am. And I've used that for years. And I'm an O blood type, so I can do all proteins. I only do dark leafy greens now, where I used to do sweet potatoes or other complex carbs. I don't do any rice. I actually went strict carnivore for 3 months, and then I added a few things back. So I've dug into a lot of the research on carnivore. I was keto for a while, wasn't happy with keto for my body. I don't process all the fats as well. I also have to make sure I take my digestive enzymes. It's really, I think another really important thing is liver health for detoxifying and gut health and being able to break those foods down. But for me, I went strict carnivore for 3 months, and now I have less than about 25 carbs a day.
I bow to that as I eat my cherries every day. I have a fruit habit and I have no issue with it at present.
Yeah. There's the diet that is cancer protective, and then there's the treatment diet that might be very, very different if someone's currently,
Absolutely.
yes. currently dealing with breast cancer. But
yeah. And again, like Steph works very, and she shares everything. So she works very intimately with a good, strong healthcare team too, right? So she's not going rogue per se. She's getting contributions from people and making well-informed decisions, right?
Well, and I've actually taken people who have gone strict vegan during their cancer visit, and lots of vegetables and very high antioxidant. And I bow to what Betty said is there are different diets for different times. My basic constitution really thrives on that very high protein and certain fats. And if I look at all of my markers, for me, this has been extremely beneficial. But you need to work with somebody, and you need to look at your DNA to know what's best for you, because that's not best for everybody.
Yeah. And I did see someone ask about thermography, and we failed to kind of mention thermography as a screening tool. I think it has its place, determining breast tissue changes, either hot spots or cold spots, just like, sonogram and like traditional sonogram or the ABUS or traditional mammography, they all have their value, and in places that are blind spots, like dense breast tissue. It is very hard to image dense breast tissue because you can't squash it enough to look at it. The reality is fibrocystic and dense breast tissue does not increase your risk of breast cancer at all. It just makes the imaging that we currently use, classic imaging, not very effective. And so I think that's the challenge, is it's almost like you want to be able to do all these different things. So screening tools like the Breast 360 allow you to have some agency at home where you can actively pursue without having to go to a facility and get squashed and radiated and all those other things,
Yeah. So if I can maybe jump on this opportunity then, and I'll try and keep the nerding to a minimal, but I'm the one wearing the glasses, so we'll see how far that goes. Let's just talk about a little bit about the test. So as Dr. Steph mentioned, it's an ophthalmic piece of paper. I'm so proud when I get the big words. And effectively, you're going to be sticking it in your eye. It sounds very uncomfortable. Dr. Steph can attest, while it's not, you're not going to want to do it every day. It's very achievable, but it goes in your eyes. And what it does is it quite literally collects all the proteins. When we think about tear fluid, one of like how our tear fluid is fed through our body is indirectly through the blood. Right. The thing is, though, what is filtered out, what you're not getting in your tear fluid compared to the blood is red blood cells, immune blood cells, and a few other things. Instead, you're just getting a lot of really small proteins. That's what's collected on this piece of paper, okay, sent back to the lab. And then the lab is going to be screening it for 2 different types of protein. Okay, the 2 different types of protein that it's looking for are calcogruin A and calcogruin B. And what those are reflective of are their proteins that help establish inflammation and effectively cancer support within the breast. And what I mean by that is it helps create an environment where cancer can thrive. Okay. And so by screening for these proteins, we're really asking the question of, is there an environment where cancer can thrive within the breast, because that's when we need to be concerned. So you get a positive, it's saying there is that environment, there is some protein that is very active in breast cancer cases, right? So I think it's 80% of stage 3 cases, you're going to see this test being positive, 90% or so within stage 4, and then the numbers sit between 50 and 40 for 1 and 2, right? So very high compared to some of the other screening methods that will be spoken to, okay? So this is not a diagnostic tool. It does not tell you yes or no, but what it says is you have the environment for this. And as Dr. Steph mentioned, it is really, really important that you start working that up, start understanding, is this just the environment, or is something growing within the bath, within this environment? Okay, so to be clear, not a diagnostic test, not a screening tool, it's early detection. It's early detection testing around, do you have this environment that there enables, right? Did I catch all that? Anything that you guys want to add?
Well, I was going to say that I think the one other thing to add is this also prompted me. I am a major, major fan of the Dutch test. I really think every woman need to know how your metabolites, break out, whether you are not on hormones, whether you're on hormones, whether you're postmenopausal, premenopausal, know what your body does. Why do some women have acne and some don't? Why can some sleep and some can't? And so how does this break down? Well, when the metabolites of estrogen break down, we have negative metabolites of 4-oxy, we have a positive metabolite of 2-oxy, and we have a proliferative metabolite, 16-oxy. My 16-oxy was off the chart. I have very little 4-oxy, which causes DNA damage. I had quite a bit of 2-oxy, which is protective, but the 16, which can actually cause proliferation and help with like osteoporosis, but it also can cause other things that aren't healthy to proliferate. So you take an inflammatory screening test, breast tenderness, and then proliferation in my metabolites that caused me to put together a shift. And this is why you want to work with a practitioner that understands kind of, okay, so it wasn't one piece. There was a heads up. Then there was a physical symptom. That was a heads up. And then there was a potential for proliferation. That was a heads up. So again, changing my hormones, changing my diet, changing my lifestyle patterns, making sure I'm getting enough sleep, doing the whole detoxification. Those were all heads up enough to go 1, 2, 3 strikes you're out. I wasn't willing to have 3 strikes you're out. And I can already tell you the breast tenderness went down and the sleep has gotten better and the skin is more radiant. So I have no doubt that my inflammation is way down, and that if I do get, because I'm just submitting the second test, if I get it, that it still says positive, I at least know that I have made some preliminary steps. I suspect that it will not show positive, and we'll see. And we can report back about that too.
I wanted to comment on the accuracy of our DNA breast 360 test, because this is important. I mean, we want to make sure that we are getting tests done that are going to give us some very good relevant information. So for the breast 360, clinical studies have shown a 91% sensitivity rate. Now, what exactly does that mean? So what that means is that this test is able to correctly identify 91% of individuals who either have breast cancer or who show cancer-related activity through these proteins detected in the tears. So let's put it another way. Out of 100 people who have early stage breast cancer or these relevant biomarkers, the test will accurately detect 91 of them. So that is really good. This gives you that early detection, that screening to then say, I need to look further into this. I need to speak with my healthcare provider. I need to look into, maybe getting some other tests.
So I want to make sure I clarify with your 91% specificity, or sensitivity.
Sensitivity.
Yeah, I was going to say sensitivity. It says to me, inflammation. because all cancers are inflammation. It doesn't say you have breast cancer. When I got a positive test, I did not think I had breast cancer. I said, something's brewing. Brewing, I would call it like you're in the kitchen, the pot's starting to move. You can see the fluid moving. It is not boiling. Okay, we're not to a boiling. But there's also specificity. And when sensitivity is extremely high, specificity can be lower. I value that because the specificity says could be inflammation, could be she had a couple rough nights, could be she's got some lifestyle. So because the specificity is so high, the sensitivity is lower and broader, which leads more to inflammation. So I continue to think of it as this says you've got something brewing, you've got underlying inflammation. What can you do about it? What I don't want someone to think is, oh my gosh, I came back with a positive test, I'm dying. That's not the case. This is your wake up. Hey, it's kind of like when you're driving a car and you go a little fast and you just avoid an accident and you say, maybe I shouldn't have been looking at my phone. Maybe I shouldn't be texting. That's a little wake up call that says, I know you're not supposed to do that. And I was doing it. Well, I was doing some of that, a little too much drinking, a little too much staying up too late, a little too much blue screen, cleaned all that up. And much happier. Now, I did see that there was going to be a question, I think it was Tracy, that said, can you explain how often to do the test and or Dutch test? So Betty, how often do you like a Dutch test? I'm okay if somebody's at a stable state, like once every 2 years. I mean, Dutches are a couple $100. I mean, they're like, let's call them 500.
They're 500 bucks.
I was going to say 500. Yeah, they are.
Yeah, so we definitely do, when somebody first, particularly if they're doing hormone replacement, we often do it somewhere within the first 6 to 9 months because we're trying to determine particularly how their genetics are playing out. But I think, again, I agree, once somebody's stable, as long as they haven't had any major change that would indicate we need to go look, every 2 years is probably fine. Just because, I would love for it to not be, so expensive, but it can add up pretty quickly. So
but your HSA can pay for it, your FSA pay for it. I've not seen insurance pay for it, but you can set that money aside with your FSA or HSA to do that. As far as the DNA Breast 360, they recommend once every year, if you're screening and you have any kind of risk factors or if you've been shown positive, but they recommend that you can do it every 6 months if, like in my case, because I'm about 5 months in, so I'm going to do it a little bit early because I've made so many changes that I will do it again. But our first recommendation is that you get your traditional diagnostic screenings, that you work with your provider, that you dig. So this as a screening is not diagnostic. And so you've got to work with hand in hand. Is it your GP? Is it your GYN? Is it, so I had late beginning of my menses. I didn't start till 16. I had babies in my 40s. I nursed each one of them, 18 months, actually not 40, I guess it was 30s, 34 and 37, but I nursed each one, so 36 months. So I have a lot of reasons to believe that I'd have no breast issues. Again, I was completely blindsided with those inflammatory, but I'd let myself get a little lazy by going, I know all this stuff. It's fine. You have to practice it, not just know it.
I think this test is important, an important piece in shifting the conversation around what cancer is, right? I think there's this idea for this really long time that all of a sudden you woke up and you had cancer. And I think we're now starting, especially with this, where we're talking about early detection, we're able to detect inflammation changes that are very specific to cancer. We're now talking about body environments that enable cancer and then cancer. Right. And I think this conversation is really important because then it really speaks to the diet and the lifestyle and the things that you can do towards the end of prevention, because very few cancers just kind of happen. A few do, but these are the ones that don't just show up overnight. You set the stage. You allow a little bit too much texting and driving.
It's kind of, you've got to remember it's the terrain, right? Weeds grow in a terrain that allows for them to grow. And I think especially, the estrogen and progesterone receptor positive and HER2 positive breast cancers are slow growing cancers statistically. They, you may find it now, but it has probably been growing for easily up to 8 years. It just happened to become visible. And to be honest, our body has little cells that go rogue on a regular basis. Our immune system, when it's robust, our, our anti-inflammatory and antioxidant system, they all work together and they get rid of those cells. And so if we take care of our terrain and our garden, we help our body do what it would naturally do. The more aggressive cancer, the triple negative, doesn't have those receptors, and it is a faster growing, more aggressive cancer. But I think that's the other thing too. It is that, oh my gosh, it just showed up. I just saw it. And I'm like, it's been there for a long time, just slowly kind of doing its thing.
Yeah. And that's, I think, as scary as that can sound, especially if you are eventually diagnosed with it, that's also very empowering insofar as you who's sitting at home listening, there's a lot of little things that can be done from that diet and lifestyle perspective to kind of shift the odds in your favor, right? If 80% of cancers are diet and lifestyle associated, that means 80% of them are things that we can do something about.
Ladies, I have to tell you, between the four of you, you are indeed an HR nightmare, but I am grateful for all you have done this evening. So there you go. Thank you all very much. As always, Dr. Murray, you are absolutely delightful. We love you. Scale of 1 to 10, a 10.
11. 11.
There you go. And to my team, as always, I can't live without you. Thank you all very much.
Thank you, everybody.
Good night, everybody.
So much fun. Thank you.